presentation. For those of you I don't know, and there are quite a few on here that I don't, I'm Lori Bunton. I'm the co-president of the ERA-NC Alliance, and I'd like to welcome all of you to our special presentation, Exploiting Inequity, COVID's Impact on Women in North Carolina. And this is in partnership with the North Carolina Council for Women and Youth Involvement. This report was compiled by the North Carolina Council for Women Advisory Board. Now, before I introduce our panel of moms, and I'm very excited because we have a panel of moms, which is highly appropriate for this report. I'm a mom of two and a grandmother of two. I'm going to do a little bit of housekeeping. So all the participants should be on mute. So please make sure you are muted. All right. And we're going to do Q&A at the end of the presentation. So at the bottom of your screen or possibly on the side, I think it depends on what device you're on, you're going to see something called chat. And that is where we're going to ask you to put your questions during Mary Williams Stover's presentation. So just keep that in mind. And again, we're going to do the Q&A at the end of her presentation, and we're going to do our very best to answer all of your questions. We'll be providing email addresses for the panelists and also resources in the chat a little bit later on. So these will be things that you can follow up with. You can, if you'd like, turn your video of yourself off. I understand that's supposed to help with bandwidth. I don't know, but I'll leave that entirely up to you. So now it is my great pleasure to introduce our guest presenter, Mary Williams Stover. Mary is the Executive Director for the North Carolina Council for Women and Youth Involvement. This state agency comes under the Advocacy Division of the Department of Administration for the state of North Carolina. She's been in her position for 3 years. And she is a proud mom of 2 children and a grandmother of 2. Our moderator is Adrienne Spinner. She is an advisory board member for the North Carolina Council for Women, a state organizing director for the North Carolina Housing Coalition, and serves on the board of the ERA-NC Alliance. And Adrienne is a proud mom of 2 and a community organizer. And our guest panelists, we're so excited to welcome Sadie Blue. Sadie serves as community consultant for the Building Stronger Neighborhoods program, which is housed at the Community Foundation of Greater Greensboro. She's another proud mom of 1. And so you've got a whole group of moms here with hopefully a lot to say. But first, we're going to turn our attention to Mary Williams Stover and learning more about what is happening with North Carolina women during this pandemic. And Mary, I believe you should be able to start sharing your screen. I think Mary might have accidentally gotten kicked off. Adrienne, I am not seeing her. Are you?
No, I'm not.
Checking to see if she's emailed. Nope.
Do you want me to talk a little bit about how the report came about?
Yes, thank you, Adrienne. Since you are a part of this, why don't you go ahead and provide some background? Thank you so much.
Absolutely. Yeah, I serve on the advisory board for the North Carolina Council for Women. I was appointed in September of 2018. And so I've just started my second term. And I'm going to try to admit people as I'm seeing them.
Oh, I'll do it. I'll take
okay.
it. You're good.
And so when COVID hit, of course, everything was flipped upside down. I think one of the big things, and Governor Cooper really stated this in April, was that COVID highlighted a lot of structural issues that were happening way before. And that's why you're seeing the most marginalized communities affected the most. And so as we moved into the summer, especially when people started becoming more and more aware of the need for structural change in our criminal justice system and really fighting against the other pandemic of white supremacy in this country, the council really saw a need to do something about it. Our mandate is to advise the governor and the General Assembly and other state elected officials on issues pertaining to women and children. So with women and children being disproportionately affected by COVID, we felt like there was a need to not just provide some data and research, but really amplify voices of people on the ground. Because our government needs to hear from the childcare worker and the stay-at-home mom and the teacher and the woman that's making minimum wage at a job that was looked over for so long. But if it's one thing we saw, these minimum wage jobs ended up being so, like, they're the essential jobs that keep our economy and our communities going. So we had a special working group of a few of us from the board that we used there was a Hawaii paper done by their Council for Women on an equitable approach to COVID recovery and a woman-centered approach. And so we used that as inspiration and then took a lot of data from North Carolina and then just started doing interviews. We interviewed a ton of women from a variety of backgrounds and demographics, and just talked about how their lives have changed. There's certain things that that have ended up being beneficial. I mean, I'm a stay-at-home mom of two, and so my kids are working or doing school from home, and I'm able to work from home. And so even as we hopefully get on the other side of this soon, I think that remote learning, virtual work, telehealth services are things that we want to keep. But then also we want to amplify some of the issues that have come across women. We're affected like no other, where we make up a large portion of essential workers. We're the group that is having to take on childcare and working full time, if you're able to work full time, because we've also been affected by unemployment the most. And so that report was completed in November, and we worked with the Andrea Harris task force that the governor started to look at racial and gender justice when it comes to COVID recovery and economic recovery as well. And then also trying to tackle some of the systemic issues of a system based on white supremacy that need to be tackled, so that hopefully we get to a point where we're not things might be a little bit better for the next generation. I'm not one that thinks there will ever be a utopia, but I think that up till now, each generation tries to take a step forward for the next group. I don't want to see my kids going through the same types of struggles and fights that I did, which is one of the reasons why I joined the ERA Alliance, because my kids, I'm going to be really ticked off if they get grown and they're still fighting for an equal rights amendment. But that's kind of how we got to this point, and how we're seeing lots of women-centered groups across the state wanting to work together.
Perfect, Adrienne, thank you so much. And Mary did have some technical difficulties, but she sent me her slides. So, and she is on via the phone. So,
awesome.
So I am going to pull up her slides, and Mary, you just need to tell me when to go to the next one. So let me get those ready. All right.
Thank you, Lori.
You are welcome. Let's see, start from beginning. Come on. All I do is get my presentation to go the way it's supposed to.
Well, we've all learned to pivot during this time, haven't we?
All right, Mary, you are up. Your first slide is up.
Well, thank you. Thank you very much. And thank you for the invitation to share some highlights with you today with regard to the Exploiting Inequity, a Pandemic, Gendered, and Racial Toll on Women and Families of North Carolina project. I'm so delighted to join you and Adrienne, who's a member of the Council for Women Advisory Board, and sharing some of the voices of women who shared their views with us. Governor Cooper said it all when he said this virus exploits inequity. And it is a truth that has been borne out in hours of interviews with women in North Carolina, and that's some of the highlights that we'll share with you. We know that this is a historic time in our nation and our lives, and so there's no surprise that there is inequity. And Shonda Hamm said it best when she says, you know, how are we feeling right now? Tired. That's a word, tired. That probably defines my new normal. And tired physically and mentally. And the weight of COVID and the social justice issues can be very heavy on our heart, mind, and body. And so that is what we heard from women overall. Next slide, please, Lori. As Adrienne said, it was important for the Council for Women, we felt, to take a step back from the work that had been done previously, because we could see that COVID-19 was having a significant impact on women, and felt it was important to document that impact. Previous to 2020 and COVID-19, the Council for Women Department of Administration had published annual reports for the past several years on the status of women. And these are some of the reports that we published. Political participation was our most recent report, published in 2020, status of women, health and wellness, and then the status of women, employment and earnings reports. These reports were published in partnership with the Institute for Women's Policy Research, which is a major leading think tank organization and research organization that provides research at the state level with a gendered lens. And so members of the board who are appointed by Governor Cooper, as Adrienne said, felt it was really important to take a step back and to document this particular time that we're living in, so that we could capture the voices, but also more importantly, just as importantly, we could identify recommendations to move forward. Next slide, please. So the women who came together and worked on the project, led by Jenny Black, who is chair of the Council for Women Advisory Board, along with the authors of the report, who I've got to give a shout out to because women worked really hard on this work. Lyric Thompson, Catherine McDowell, our own Adrienne Spinner, Candace Jingles, and Patricia Parker were people who worked tirelessly, and also Annette Taylor, who represented the Council for Women on the Andrea Harris Task Force, produced this exceptional project that we released at the end of December. So I just want to continue to thank them. And you can see the full report on the Council for Women's website. So we were intentional in our efforts to reach a cross-section of women. We wanted to not only include quantitative data from the previous status of women reports, but we also wanted to include qualitative interviews that represented the voices of women. And so just a caveat here in that, given the time that we had available to us, the women who were invited to share their stories with us and their viewpoints were women who were identified by members of the council. And so I encourage you, as you all move forward in your various organizations and efforts, to continue to listen to women in your communities, to capture their viewpoints as well. This doesn't represent an entire statewide view. It does represent the voices of women that members of the council were able to identify and to capture through the interview process. And we know that the challenges and struggles represented and communicated by the women who participated in the study really represent the tip of the iceberg. And I want to thank them for doing that. The women who you see pictured here, in fact, are women who are chair leaders of Women's Council for Women's organizations in Charlotte, Durham, and in New Hanover County. I just want to give a recognition to those women for sharing their time and their voices with us. Okay, next slide. So before we talk about just want to remind you, pre-COVID, where we were when we look at health and wellness of women in North Carolina. As I indicated, the Council for Women had produced the Status of Women report previously to assess women in various areas, looking at mortality rate due to chronic disease, and looking at heart disease, cancer, diabetes, stroke, gonorrhea, chlamydia, and AIDS diagnosis. We saw that when we compared the status of women's health and well-being, we ranked 40 out of 51 states. That's the composite ranking pre-COVID. That resulted in really a grade of a D for North Carolina. So this is pre-COVID, right? And that's not acceptable. Certainly, we know we have work to do, but it's important before we look at the voices, hearing the voices of the women who shared their viewpoints with us, that we take into consideration where we were even before COVID-19. We know we have work to do in terms of women's health and wellness, and that there's a lot of room for improvement. Next slide. The slide I hope you're looking at gives you an overview of the disparity by race with regard to the mortality rate for heart disease, stroke, breast cancer, and diabetes. This slide really hurts my heart because when we look at this data, we see that Black women in North Carolina have the highest mortality rate in each of these areas. And Native American women tend to fare poorly as well when it comes to heart disease and have the highest diabetes mortality rate, second to Black women. Hispanic women in North Carolina have a lowest mortality rate for heart disease, but trends indicate that Hispanic women are also seeing increasing mortality on heart disease and stroke. So basically, we know pre-COVID that race and ethnicity are factors in terms of overall health and wellness for women in North Carolina. Next slide, please, Lori. Women in lower economic brackets may not have health care access, and domestic violence doesn't discriminate. We need a safe place for women to talk about mental health and stress issues. There is a pervasive feeling of not being safe. These are words from Catherine Wadling, who's chairwoman of the New Hanover County's Women's Commission, when she shared her viewpoints with us in terms of how she's experiencing life during COVID-19. As we said, Black North Carolinians make up 22% of the population, but at the time of the report, they were 25% of COVID-19 deaths. There's a disproportionate impact of the virus. 94% of domestic violence service providers in our state reported unexpected costs associated with the pandemic. We know that the rate of domestic violence has increased. We know that victims are continuing to need support services, and there's a lot of concern about what's going to happen post-pandemic. So there were also concerns about hate crimes that women expressed, and threats of voter intimidation and risk of deportation. And then, of course, the overarching expression of concern about the increased burden of caregiving responsibilities that women are experiencing as a result of COVID-19. So we also asked women to share with us and discuss, well, how do we begin to address some of your concerns? What would you say if you had a moment to talk to legislators? What would you do? And we also heard and talked about what we'd like to see: universal health care coverage, mandated paid leave. We need support for women who have to return to their homes or who are at home and can't work. And we need to sustain CARES Act level funding for domestic violence and sexual assault program providers. $12 million was appropriated from the CARES Act for North Carolina domestic violence and sexual assault programs, $6 million for domestic violence, $6 million for sexual assault. This was a phenomenal asset and resource and far exceeded the funding that had been appropriated previously. And it was much needed. It is time limited. And so this funding will not reoccur unless there's another appropriation in that regard. And so, as I said, the demand for these services continues. And so how do we prepare now to help nonprofits who are unable to conduct fundraising campaigns and unable to do the kind of outreach that they had done previously? How do we prepare them moving forward? We also, when we talk about the paid leave, we know that there's some work in other states. This month, for example, in Representative Rosa DeLauro in Connecticut and Senator Kristen Gillibrand in New York introduced the Family and Medical Insurance Leave Family Act, which grants workers up to 12 weeks of paid leave due to illness, childbirth, or providing for care for a loved one. So we are seeing legislators making an attempt to begin to address some of these issues. Next slide, please, Lori. When we look at labor force participation, looking and pulling from pre-COVID data, again, for every racial and ethnic group in North Carolina except Black women and men, men are more likely to be in the labor force than their male counterparts. Among North Carolina women, Black women are more likely to be in the labor force at about 63%, followed closely by women of another race or two or more races. Part of, though, what this slide shows, again, is pre-COVID disparity in terms of who is in the labor force. And we know what has happened as a result of COVID with regard to unemployment. And so this begins to give you some sense of who is impacted as a result of COVID. Next slide, please. This slide, which I hope you're seeing, talks about and shows that while fathers of children under age 5 are in the labor force, that look at the women who are in the labor force. And these are women who have children who are under 18, and they are employed in the labor force, 74%. So this slide, pre-COVID, again, just shows you and illustrates when we talk about women who are now unemployed and who have had to make difficult choices, what their participation in the labor force was pre-COVID. Next slide, please. So now when we ask women about the impact of COVID-19 with regard to their employment, we of course see disproportionate rates of unemployment. We know that there is increased food disparity and housing and insecurity for women and women of color. And we know that women and minority-owned businesses have been hard hit. School closures and a lack of access to resources for children has made life challenging, to say the least. And so when we look at solutions, we have to hold up the fact that we have to invest in our care economy. Women making the impossible choices need support. And we have to protect and compensate essential workers and increase public and private sector investment in women and minority-owned businesses and help women by providing technical assistance. Some of this great work is going on. We know there's a lot of effort by agencies. Historically underutilized business is one agency in the Department of Administration that's reaching out to minority and women-owned businesses. And we need, and this is the top of mind conversation for every parent now, which is a strategy for safe and effective schooling. It is a major concern. Next slide, please. So we talk about, and I know you've heard the term, the she session has begun. COVID has basically changed the trajectory of employment, and we see significant decline in employment. I just saw a report that said women employment has declined by 21,000 last month, while men's employment grew by 200,000 nationally. So again, we're seeing not only pre-COVID, we knew that men were in the workforce, but right now we're seeing just such a harsh disparity. One woman we talked to said one of our members left her job due to being a single parent of 2 sons and having to make a choice between leaving her children home alone or working. Her position was terminated. How do you make that choice? That's not a choice. And so we're continuing to look at the impact of COVID-19. And we've talked about civic and political life. Our Status of Women report on political participation highlighted many inequities in terms of representation of women, both in our North Carolina General Assembly, but also in Congress. And I think this quote by Dr. Tracy Ray sums it up in terms of what we heard from women. We need to work on getting more women to the legislature, she said. We need to be at the table writing the policy and where the conversations are happening, and we need more minority representation. The challenge is that women are caregiving for parents, kids, grandkids, and how do I run for office? We are at a time now where how can I not do it? So once again, our pre-pandemic research found that the baseline for North Carolina women is poor when it comes to participation. And so when we think about political representation and what we heard from women, we heard a lot of concern about a lack of security and peace with regard to voting during the social issues and threats to their security. We know that we've witnessed violence at the state capitol in a way that Governor Cooper and others have condemned. We know that we're still having conversations about wearing masks, and that has become a political issue. But we also know that women are engaged and continue to be engaged in public policy, despite their fears and concerns. And so when we talk about recommendations, again, increasing representation of women, Black, Indigenous, Latinx, and people of color, and attention to their rights in the state's pandemic recovery response is crucial. And increasing compensation for legislators. You don't get paid enough to be a legislator unless you have another source of income. And so that's something that needs to be considered when we talk about having more women involved as representatives in our General Assembly and others. So we know that there are bright spots. I look to Durham as a bright spot with the all-female county commission. So we know that change is happening. And certainly when we look to Vice President Kamala Harris election, there is still a lot of work to do. One of the interesting questions, and next slide, please, Lori. I hope you're looking at a slide that says innovation in the face of devastation. The next slide there asked women, okay, is there anything about this process you'd like to keep, you'd like to see continue? So we're all learning how to pivot and survive during the pandemic. Many women reported in the interviews an appreciation for the flexibility of teleworking, those who are able to telework, the end of the commute, and more virtual services such as telehealth and church and court. And women talked about the fact that we need bold solutions. The board, in looking at recommendations, identified the need for continual policy changes and investing again in the care economy and promoting employers to take action with regard to paid leave, child, elder, and disability care incentives. And of course, improving the state's unemployment eligibility, benefits, and duration. At the end of the day, we need a gender and racial equity lens. Governor Cooper has certainly done a lot during his term, his first term, in signing executive orders to provide pregnancy protection and paid parental leave for state employees in his cabinet agencies. But we need to look at more of these kinds of efforts to increase equity as we recover. So I'm at the slide now where I will take questions. And as I wrap up this presentation, I want to hold up the idea that all of us can contribute to the process of building back better for women in North Carolina. Now is our time to take action, to look ahead to the next round of elections, to register to vote. We know in North Carolina, 1/3 of women are not registered who are eligible to vote. Certainly now is the time to support the kind of policy changes and recommendations that have been identified. We know that women are involved in civic life and that the issues that matter most to women and families get more traction when we're at the table, when the votes are counted, when we're at the policy-making table. So think about joining a women's commission in your county. If you don't have one, please talk to me about starting one and get involved in organizations like the ERA Alliance and others, and support your local domestic violence and sexual assault agency who needs your time, talent, and treasures. We know that we can make change happen when we work together. So I want to just thank you to the ERA Alliance for hosting this program and others who are stepping forward to be part of the solution. And I'll now turn the program back over to you, Lori. Thank you.
Thank you so much, Mary. This is excellent. In fact, I'm going to turn this over now to Adrian, who is going to moderate our Q&A session. So I'm going to stop sharing, and that way we can monitor the chat. Adrian?
Thank you, Lori, and thank you so much, Mary, for the presentation and for all the work that you're doing. If anyone has a comment or question, feel free to throw it in the chat, and we can ask Mary. Kate asks, does the care economy include unpaid labor?
Exactly. That's what we're talking about. Think of the women who are now at home caring for elders and seniors and children. And certainly they're not getting paid for doing that, right?
Yeah.
And many who talked earlier have left her job, so she's not getting any money for providing the services. And certainly that's part of the care economy. But also when we look at the impact of COVID, we see that essential workers are the ones who are impacted to a great deal, right? People who are working in grocery stores and working to keep our systems moving forward and operating. They are put at risk in order to continue to provide.
You're breaking up, Mary. Are you still there?
Yeah, I stopped talking.
Oh, okay. I just wanted to make sure you kind of gone in and out at the end. But yes, exactly. The folks that are working the hardest are not being paid, not being compensated. There's also an argument to be made that if we're ever going to reach any kind of decent, and I'm not even talking about adequate, but decent recovery, we're going to have to up the minimum wage, just period. We cannot contend with the minimum wage from the 80s. And I will just use a disclaimer. My daughter is doing a science class online. And so it's, yeah, at the same time as this. So if you hear any screams in the backgrounds, because I guess her experiment's going well. Where can we receive a copy of this presentation?
Are you asking for a copy of the report or the copy of the slides? The report is online at the Council for Women .nc.gov, and I can send Lori a copy of the presentation so that she can share it with folks who registered for today.
Awesome, thank you. Let's see, Yvette says, thank you for mentioning the difficulty in being an elected official because of the minimum salary. Hold on, I just lost the rest. Okay, it seems that only those retired or who own a business can serve. How do we start the process of a resolution to change this to full-time in all elected offices?
That talk to your legislators. It's kind of a double-edged sword, I think, for legislators, because those who would support it don't want to seem as if they're, self-interested. But we know that it's not enough money to have women and represented in the General Assembly. And you're right. By and large, when you look at who is in the Assembly, it's women and men who are retired, who have steady and other sources of income. So it is something to talk to your legislator about.
Absolutely. Yeah, I think that there are a lot of women that would run for office, that need to run for office. I'm of the mantra that women get shit done. And oftentimes the best man for the job is a woman. But if you're not paying them, if you're not providing childcare, if the cost of expenses and travel and childcare far outweighs what you're being paid, then you're only going to have older, retired men that don't have the at-home responsibilities or don't take those at-home responsibilities. So yeah, things need to be changed. And then also, if you know a woman that's running for office, if you see women that are putting themselves out there to campaign, is a hard thing to do. I speak from experience because I ran for office. Support them, support their campaigns. Don't buy into the whole mantra that women are electable or this electability kind of thing. Support women when they're putting themselves out there to run. Lori, did you